Cervical cancer is second most common cancer in India. Still, it is very common in rural areas and low socioeconomic areas. Every year, 60,000 females die because of cervical cancer. Unfortunately, it's diagnosed in a very advanced stage. The symptoms of cervical cancer include bleeding, especially post-menopausal bleeding, foul-smelling white discharge from vagina, pain during intercourse, bleeding after intercourse, and low back pain. Cervical cancer is associated with human papillomaviral infection. It is shown that human papillomaviral infection increases the risk of cervical cancer. Apart from this, any condition which reduces the immunity, like HIV or drugs which reduce the immunity, chlamydial infection, or prolonged use of OCP are also shown to increase the risk of cervical cancer. Cervical cancer can be detected early with the help of screening methods. After the age of 25 years, we should go for regular screening for cervical cancers. Usually, the screening is done with the help of pap smear and human papillomaviral kit. If the reports are normal, one can go for screening once in 5 years. But if only pap smear is done and the report is normal, screening has to be repeated once in 3 years. In case there is any abnormality in pap smear, or if someone is diagnosed with human papillomaviral infection, the screening has to be done every year. The screening will continue till the age of 65 years. Nowadays, we have vaccination available against human papilloma virus, which reduces the risk of cervical cancer. It can be taken from the age of 9 years to 14 years till the age of 45 years. Ideally, it should be taken before marriage. Cervical cancer can be prevented with regular screening, vaccination, and good personal hygiene. Apart from that, we need to adapt a healthy lifestyle, balanced food, and regular exercise. Nowadays, we have latest therapies available for treatment of cancer. For example, we have breast conservative surgery, oncoplastic breast surgery, laparoscopic surgeries, and robotic surgeries. Similarly, we have advanced chemotherapy drugs with less side effects. Similarly, targeted therapies and immunotherapies are available which help us to fight against cancer with less side effects. When it comes to radiation, we have latest technologies available including IMRT, that is intensity modulated radiation therapy, image guided radiation therapy, rapid arc, stereotactic body radiation, and stereotactic radiosurgery. Gene testing is done to detect the risk of developing cancer in a particular individual. It only tells us the probability of developing cancer in a particular individual. It is done for someone who is having a strong family history, especially in one side of the family. It helps us to go for regular screening checkups, preventive surgeries, and adapting healthy lifestyle.